Before we get started, I would like to thank ASPCA, Cornell University, and Maddie's Fund, not only for sponsoring this conference, which is a great conference and a great opportunity for networking, and I'm so glad to see so many of you here, but also for inviting me to come and speak, and to talk about some of my favorite things, and that's where shelter medicine and public health overlap, and zoonoses are a lot of fun. So you might not think that. You want to get rid of them, keep them out of your shelter, and that's great. And I'd like to, hopefully in the next 2 hours, provide some information that can help you better approach zoonotic diseases. Each one of them has differences, that's no surprise, but the first thing that we want to do with any disease, and especially with zoonotic diseases, is learn a little bit more about it. How is it transmitted? What materials are infectious? What's the incubation period? What's the infectious dose? How can we kill it? One of the more important things. So those are the kind of things you want to start with, and I'll try and include some of that information throughout when we cover some 4 major diseases. I wanted to touch on rabies. I will be presenting in the tech track an overview of rabies and how to assess exposures and how to follow up on those. But here I wanted to just kind of touch on the impact and what a shelter's response might look like if they have a case of rabies in their shelter. And Salmonella. And then in the next hour we'll touch on Brucella canis and Campylobacter. Okay, and feel free to ask questions. I welcome them. I enjoy getting to talk and not just talking to you. All right, so I think it's important to realize, obviously, animals in shelters can serve as sources of infection for other animals and for people in the community. And that raises it to a whole nother level over our typical animal diseases when we're dealing with animal disease outbreaks, when people can also become infected. That changes the landscape quite a bit. And we need to be very careful because as we're concentrating animals in this environment and housing larger numbers of animals in close proximity to each other, especially with time restraints on cleaning and disinfection, it creates the kind of perfect storm for disease to spread within a shelter or amplify shelter-acquired disease, and then again disseminating into the community through visitors or through adoptions or foster homes and things like that. Also, and I mentioned last night that animals can serve as sentinels. So there may be a disease that's entered a community that we're not aware is in our population, pet population in the community, until we start to see it in shelters. Because we tend to work with so many of the animals in a community, we are often the first to recognize those types of things. In Texas, they were looking at Chagas disease and found that a significant number of the dogs had antibodies to Chagas, meaning that it had spread beyond those concentrated hotspots where people thought it was isolated. So shelters can play a really important role from that respect as well. The other thing I think it's important to think about is like who's responsible for zoonotic disease issues. And they've done studies where they've talked to MDs and talked to veterinarians and talked to public health. And it really does kind of look like this. Everybody thinks it's somebody else's job. So it creates a gap often in our response and in our vigilance with following up with these cases. So I think shelter medicine and public health tend to be in the middle. And we're going to be actively involved in these things. And sometimes we're educating not only the public and our staff, but also the human medical field and sometimes the public health field as well. So starting with rabies, this is Johnny. And several years ago, Johnny was picked up by a Good Sam. He had a broken leg, and he was taken to a shelter in North Carolina. Anybody here know or remember Johnny? I'm not sure if we have. I know we have some people from North Carolina here. All right, so the shelter worked with local veterinarians, and veterinarian Dr. Bob Whedon volunteered to repair this leg so they could get him adopted, which was great. So he went to the veterinary clinic. It was an open fracture, so they did lots and lots of bandage changes, and he was doing really well until he wasn't. And about 2 weeks after his intake, he started acting strange. And they thought maybe that he'd gotten some aspiration pneumonia or something else from his sedation for his bandage changes, but it started to progress pretty rapidly and developing neurologic signs. So they euthanized him Rabies really wasn't on their differential list initially. They had a lot of things on their list that this might be, and rabies was not among them. But good veterinarian being what they are, neurologic signs equals rabies testing, right? And that should always, always be the case. So they did test him and he was positive. That started a huge investigation of all the people who were caring for and handling this very adorable puppy. So the cuter they are, the more people are exposed. You know that, right? They're cuter, more people are exposed. So they ended up with 50 people who received post-exposure prophylaxis. And the shelter, though not required to, they certainly were expected to bear that cost. And they did, and it was very expensive. So we always want to think rabies. With every neurologic case, when we see behavior changes, typically the first signs, this is not acting like this dog, we need to be considering rabies. And even veterinarians we don't see very many cases, so we don't think about that at the top of our list. So Dr. Whedon had shared the signs and symptoms and progression of Johnny's case with several veterinarians. And then again at a conference, he was very curious and he just said, what are your differentials? And only 10% of the vets he asked put rabies on the differential list. And clearly that was rabies. Kansas State has 2 videos that they put together. They're nice, about 5 minutes each, interviews with Dr. Whedon. I wanted to share one with you today, but I didn't want to take up so much of the time. But if you're interested, those are really nice, nice reviews on the K-State website. We talk about dogs a lot, but I want to remind you that cats are 4 times more likely than dogs in the US to develop rabies. And we see more cats in our shelters. So we need to not just think about dogs when we're concerned about rabies. Also, when there's a case of rabies, cats tend to expose 7 times more people than dogs do, right? They're less likely to see vets. Even if they see a vet, they're less likely to be vaccinated against rabies, and we think these and some other things contribute to why we see so much rabies in cats, especially on the East Coast. So rabies, I don't want to get into too much. I think you guys are very familiar, fatal encephalitis. Everybody talks about abortive cases and our occasional recoveries, but this is not a lottery I want to play. This is pretty much 100% fatal with some rare exceptions. So I wouldn't think that we're working towards a less virulent rabies virus. We are not. It is bad news. One thing I do want to share is a little bit about this long incubation period, because this is a challenge for a lot of people when they're just trying to decide how to manage it, and the variability of the signs, because when I say any neurologic, that's what we mean. It can have so many different presentations. There's a classic, but there's not one that's expected. Like there's not a pathognomonic presentation. So when someone is bitten, and that's how most exposures occur, the virus enters the body, and it's a pretty wimpy virus. So it doesn't do well outside of nervous tissue. So it hangs out there desperately looking for a nerve. And if it finds one, it's like a highway straight to the brain. So the incubation period is going to vary based on a lot of things. One, how much virus was inoculated, how far away the inoculation site was from the brain, right? So toes versus nose. We're going to have very different incubation periods for those 2 bites. Okay. This has a great deal of information, and this is what I refer to a lot when I'm explaining to students and veterinarians the difference and the reasoning behind a 10-day quarantine and a 45-day or a 4-month or a 6-month isolation period, right? So exposure here occurs, time progresses here, and all that time where it's finding a nerve and it's traveling up the nerve to the brain, you're not contagious. And this is our incubation period. And once it gets to the brain, it starts replicating like mad, because this is exactly where it wanted to be. And depending on which parts of the brain are most affected, that dictates which clinical signs you're going to see. So clinical signs onset here. And this can be weeks, months, and in humans over a year. Most of our cases are going to be occurring 3 weeks to 3 months for pets, and within 4 to 6 months for humans. All right. Now our 10-day quarantine occurs for several reasons. This is our 10-day quarantine period. But note right here that we can become contagious before we develop clinical signs. not very long before, just a couple days for cats, dogs, and ferrets. For other species, this can be a longer period of time. And then we see, especially in wild carnivores and other wild canids, which is why wolf dog hybrids are not eligible for the 10-day quarantine, because we know that this pre-clinical infectious period can be longer in certain species, okay? So the 10-day quarantine is only for cats, dogs, and ferrets, and in New York, livestock, because they pretty much follow the same pattern, all right? Does that make sense to everybody? So if you're bitten and you want to quarantine the animal that bit you to see if it was contagious at the time of the bite, 10-day quarantine for cats, dogs, ferrets, and livestock. If you're an animal or a person who was bitten and you want to quarantine the animal or person that was bitten to see if they're going to develop rabies in the future, then we're quarantining for this incubation period, right? And that's why we get out into this 4 months or 6 months time frame. Does that make sense? I get so many calls from veterinarians or hear from clients who say, my dog got in a fight with a raccoon and my vet put my dog on a 10-day quarantine. And that's not going to be effective, right? That's pretty much done nothing except for give them a false sense of security, okay? So I think it's really important to understand the differences between those. And we have, just for funsies, had dogs that were on quarantine for being bitten bite someone. Yay! So then we do a concurrent 10-day and 6-month quarantine. That gets really fun to explain to everybody. All right. I found it interesting. Most of the states address dog, cats, and ferrets with their requirements and leave the other species at the discretion of the health department. That something needs to be done based on the risk assessment, but what isn't really clearly spelled out. But in New York, domestic livestock also are rolled into this 10-day quarantine period. Right? So again, isolating exposed animals for a time period based on the incubation period. So if they're current on vaccination, this is booster and a 45-day quarantine. It's because we get a really strong anamnestic response from that vaccine, and we know that it provides very good protection against rabies. And it is believed that if you're going to develop rabies when you were vaccinated, it's probably going to be some overwhelming exposure, and those tend to cause disease much faster. So that's why there's a shorter time period for that. If you're not vaccinated and you're exposed to a rabid animal, euthanasia is recommended. That is a very high-risk situation. The challenge comes in that we don't always know whether we were exposed to a rabid animal or not. Maybe there was a bat and it flew away. We don't know if it had rabies. We don't know if there was an exposure. Same thing with my dog got in a fight with something. We don't know whether that was a raccoon or a cat or another dog. So we start introducing all of these uncertainties. Euthanasia seems a bit harsh. And so that's where the extended quarantine comes from for those exposures. And most states require a 6-month quarantine. The Rabies Compendium, yes, recently was updated in 2016, and all of the state regulations were based on what the Compendium had said for the last 20 years. And in 2016, they made some updates. Most of the states, though, have not changed their regulations accordingly. So whatever state you're in, your state regulations are what's required to be followed, regardless of what the Compendium says. But I'm going to share with you some of the changes in the Compendium because I think it's important to be familiar with them and the science behind them. So hopefully all of you are familiar. This gets published in JAVMA every time it's updated, and it's available online at the NASPHV.org website. Right, so no changes to our currently vaccinated booster and a 45-day quarantine. Booster on intake into that isolation period. Again, you're going to get a strong anamnestic response to that vaccine. Most states dealt with overdue vaccines by lumping them in with unvaccinated. So if you're overdue, you're not vaccinated. So that guidance has sort of changed because they know that that vaccine, even if you've only ever received one in your life, is going to provide some benefit to you, especially if we can get a booster vaccine. So if you have proof that you were prior vaccinated, booster and 45-day quarantine. right? And proof isn't just rabies tag or I vaccinated my dog a couple years ago. You need to have a certificate signed by a licensed veterinarian in order to show that that dog was vaccinated. Mm-hmm. Right, so the question is, am I talking about an animal that's bitten someone or an animal that has been bitten and potentially exposed? So if an animal bites somebody, that was what we just discussed with the 10-day quarantine and how that works. Now we're talking about the animal as being exposed. So let's say there's a dog in the backyard and gets in a fight with a raccoon. Okay, so the dog's been exposed to rabies potentially, and these are our options and how we decide which one we're going to do. Okay, does that make sense? Thanks for the question. So the compendium recognizes what an amazing vaccine the rabies vaccine is and says that even if they're overdue, you can treat them as current because they're going to respond to that booster, and 45-day quarantine is adequate. Again, state regulations may not have followed that yet, but that's something in your states that you may want to be discussing with your veterinary medical boards and maybe getting those regulations updated. All right. Unvaccinated, still the same. Euthanasia is recommended. And then if you're in doubt, like you're not sure if this was an actual rabies exposure, then a quarantine period can be put into place. And 6 months still recommended for ferrets, but for dogs and cats, based on following the many, many dogs and cats that were exposed to rabies that were quarantined, they shortened that interval to 4 months. Might there be a case that occurs after 4 months? Yeah, but there might have been a case that occurred after 6 months as well. Those outliers are rare, but they're possible. 4 months is going to catch just as many of them as 6 months did. Does that make sense? But it's a little bit less onerous for the people involved. This is a new recommendation as well that I found very interesting. So if we're overdue, or even if we're current, but we have no proof of vaccination, so you really don't know, and it's their word. We don't risk people's lives on the word of just about of anybody, really. You can do paired serology. You can treat them as if they're unvaccinated, or you can do a paired serology. So you draw titers, booster, and 2 weeks later, usually draw the titers again and send those out. And if you've got an anamnestic response, you know that that animal was previously vaccinated, and then you can manage them as previously vaccinated with the 45-day quarantine instead of the 4-month or the 6-month quarantine. Yes? The window that you want to booster an animal by, so you want to follow label directions on the vaccine product that you're using, and we have vaccines that are approved for 1-year intervals and 3-year intervals. So your first dose can be given, again, based on the label, 12 weeks, 16 weeks, or older. And then your first booster occurs within that first year. And then after that, if you're using the 3-year product, you can booster every 3 years. Does that answer? Yes?
I think her question might have been the window after the exposure, like getting bitten.
Oh, okay. So the question is, what's the window after the exposure? Just as with people, we don't have a lot of data on how long can you go before it's too late, right? There's so many variables that impact your incubation period. If you get bit on the nose, you don't have a long time. You're talking a couple days. You get bitten somewhere else, you might have a couple weeks for that to take effect. So in general, when I'm not going to talk about human post-exposure, but for animals, you're going to want to get that in within a couple days. Okay, so it's not an emergency. You don't have to go straight to the ER at 3 o'clock in the morning and get it done, but you're going to want to do it the next day or two. I think the New York regulations, because I looked those up, require that it be done within 5 days, that you booster within 5 days. It's a great question. Sorry, I didn't understand it. Okay.
I could be wrong about this, but I thought, and somebody will have to correct me, I thought if you have a pet's been bitten and it's an unknown exposure, I have been told at various times by the state that you shouldn't booster during that 10-day period in case there's a reaction to the rabies vaccine causing neurologic signs.
So the question is, how do you time vaccine booster in an exposure event and balance that with the risk of an adverse event? For an animal that's exposed, so we're going to be entering a 45-day or 4-month or a 6-month quarantine period, booster on entry into that quarantine. If there is an adverse event that could mimic early signs of rabies, it's really too early for that animal to have developed clinical signs, right? So that you know that that's probably an adverse event. It's too soon for clinical signs to have developed in the first few days. It just doesn't happen. So you want to give that animal as much benefit from that vaccine as possible to get their immune system to be producing antibodies to recognize that rabies virus so it can kill it before it gets to the brain, okay? If it's a 10-day quarantine, this animal bit somebody, you're watching this animal for adverse signs, any signs consistent with rabies. The recommendation is not to vaccinate at the beginning of a 10-day quarantine. So that's what, you're absolutely right, that's what you're hearing, but there is a difference between those two quarantines, and it has to do with where they are in the cycle of rabies. Like in a 10-day bite quarantine, they're getting ready to show signs, if they're not already, right? So then you do definitely want to withhold that, and then make sure they're current at the end of that. And I've had people ask me, oh no, we vaccinated, do we have to start the quarantine over, things like that. It doesn't impact your quarantine period at all. It just introduces a slight risk that you may euthanize an animal that didn't need to be euthanized because of an adverse event that looked like rabies. Great questions. All right. So I wanted to share with you really quickly this event. So this was, there's been so many very similar situations, but this one was written up in an MMWR, had a lot more information to share with you about that. So North Dakota and Minnesota in 2010, there was a dog that developed rabies in the animal shelter. All right. So we have a dog diagnosed positive rabies. We have an animal shelter full of dogs. How are we going to identify other animal contacts? So you're the shelter vet. They're like, okay, which animals were exposed to this dog potentially during their stay in your shelter? What information are you going to use to help you decide that? Shout it out. Cameras, maybe. You can watch the camera footage and see. It's going to take a long time to do that, but you certainly could.
I'd like to rely on staff, but I think I feel better about cameras.
And you could talk to your staff and see if they know of specific contacts, direct contacts that have occurred, right? What other information can you use? Bite wounds, well, certainly if you have a bite, hopefully you've documented that bite. Yep, and you're gonna look at that. Dogs on either side. Look at your housing system. So do you have solid all the way to the ceiling? Are they able to have direct contact over the top of that concrete divider or metal divider? If that's possible, you need to consider the ones on either side exposed. We need to assume there's been contact whenever there's opportunity for contact. Similarly, the fronts of the cages, a lot of times people will walk the dogs through and they're like, hello, 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 stopping at every cage. Or sometimes even during cleaning, letting them loose to walk around or tying them out to another cage. So what activities are occurring in the shelter that you can look at and assess whether there's possible exposure occurring through those activities or not. Playgroups, that's a really common one. So how many of you keep a log of your playgroups as to who's in which group? Excellent. A couple people do. Most shelters don't. But that's something that you might want to consider doing. It could be a very valuable tool if you have a zoonotic disease, especially rabies. Surgery records, that's important too. You want to see who was in surgery on that day. There's often a lot more opportunities for contact in those surgery environments during recovery or with people running around monitoring mouth to mouth, those types of things, and interviews with staff, right? So in the interest of time, although I'd rather have you guys tell me, what types of activities are we going to be looking for? And these are really important to sit and think about what happens in the shelter that could transmit rabies that you want to specifically look at. So we've identified which animals may have been in contact. But do we have commingling in our runs or contact through and between the cages? And we talked about that one already. Behavior testing, too. A lot of times there's tester dogs, so you'll want to take a look at that. Sometimes on walks, you have a lot of volunteers walking dogs. They might play a little bit, not an official play group, but that activity might occur. Shared toys, are they playing with frisbees and balls outside? A new group of dogs comes out, but those toys are still wet with saliva. That could be an exposure as well. So as you can imagine, it can become very challenging to track down which animals might have been exposed. In this shelter, they had concrete runs that prevented a lot of the contact, but they had commingling, and they also had contact at the front and then over the top. They had play groups, which they didn't track. There was every day, it was a different group of dogs. And so the health department did order that all the 25 remaining dogs be euthanized because of the risk of rabies in that situation. The majority of them had not been vaccinated against rabies to anyone's knowledge. And I know that's a hard reality and not one that we want to hear, but I would ask you to also consider the impact that 6-month quarantine with strict isolation, so social isolation complete, no other animals, no people contact beyond what's absolutely necessary, that's a pretty hard sentence for anybody. So it may have been the better of the two options in this case anyway. So 37 dogs had been adopted. We're not just done with the dogs in the shelter, but who was there at the same time that maybe isn't there now? Were they adopted? Were they reclaimed? 37 dogs, and they followed up with those. 12 were considered current on their vaccination at the time of the exposure and were quarantined for 45 days in their new owners' homes. 25 were considered unvaccinated at the time of the exposure. 11 of those were quarantined for 6 months, 13 were euthanized, and 1 died and was lost to follow-up. So just to give you the outcomes of those. This is a zoonotic disease, right? So we're not done. We need to think about the people. So we've got a lot of staff, a lot of volunteers, we've got a lot of public. How are we going to identify which people might have been exposed? So what about our staff and volunteers? What information can you turn to? Anybody? Ask them. You can interview them. And actually, that's what it comes down to a lot of times is individual interviews. Usually the health department will interview all of your staff and potentially all of your volunteers. It's very time consuming. But there are other methods that you could use to come up with a list of people that you know had exposure. Timesheets, right. When did they work and in which wards were they cleaning when they were working? Same with volunteers. If they log in, you can find out for sure who was there. And that way, when they are doing the interviews of everybody, if they don't ever show up, they're going to go find them because they know that that's a high risk. And they're not just going to say, they didn't come, so it's not a problem. What about the public? People who came and who didn't adopt. We know who adopted, right, because we have their records. Sign-in sheets. How many of you do sign-in sheets for all of your public? That's great. That is great. I wish more shelters did that because we've had to track with international rescues. There have been quite a few rabies cases that have been imported from international transport, and so then it turns into these huge events trying to identify who's had contact. Sign-in logs are really helpful, adoption, reclaim records, and often we have to go to the media to identify potential exposures. So when you involve the news, that raises the whole game for everybody, right? You're going to be getting inundated with calls. All right, so what types of activities are we going to be concerned about? So now that we have people who say, hey, I was at your shelter on this day, we need to ask them some questions to find out whether they were exposed, potentially exposed or not. So the first one is, were you in the shelter on this day? Because you're going to get calls from people who drove by and waved and are now really concerned. So were they in the shelter? Were they in the ward? Did they see this dog? Did they pet this dog? But what other types of activities are we going to be concerned with? What are we going to ask them about? Because we can't just say, were you exposed to rabies? Nobody knows the answer to that question. Well, I do, and some of you do, but the public don't. So what activities are going to be considered a rabies exposure? Exposure to saliva, right. So are they playing ball and taking a wet ball from the mouths? Those kinds of things. Are they feeding? Are they licked? So often we'll say, did the dog lick you? No. Did you hand feed the dog? Oh yeah, I had these great treats and I hand fed him. They don't consider that being licked, but it absolutely is, right? So we need to ask those kinds of questions to find out what the exposures were. What about your staff? What activities are you going to be concerned about among you and your staff? Innovation, right. So even during your physical exam, if you're aging, if you're doing a gag reflex, mucous membrane color, capillary refill time, so monitoring anesthesia, intubation, all of these activities, administering oral medications, all of these activities can be considered a rabies exposure. So you're going to need to talk to your staff and find out who's had what types of interactions in order to identify which people are exposed. And you're going to do that in conjunction with the health department, provide them the list. They're going to conduct very detailed interviews with the people and then assess whether or not they should receive post-exposure prophylaxis based on the answers to those questions. So in this case, they had 3 members of the family that found the dogs, 9 shelter employees, including vet and a volunteer, 5 members of the foster family who fostered this dog, and one of the neighbor kids who'd come over to play, and 2 children who had visited the shelter and been licked by the dog. Yes?
Question, you know the day that the dog showed symptoms and was tested and everything, but how far back are you looking at exposure to that dog?
That's a great question. So when you have an animal that's diagnosed with rabies and is demonstrating clinical signs, how far back do you go to assess exposures? And in public health, we like to throw around the term abundance of caution, right? And that's really true. The 10-day quarantine already has padding in it. 10-day quarantine, abundance of caution. So what we do is we assume the worst case scenario. So the first day that we recognize clinical signs, maybe not a couple days later if it's diagnosed, then we say, we assume that this was the end of the 10 days and we go back 10 days. Again, abundance of caution. That person on day 1 or 0 probably really wasn't at risk, but we're already going to build in that buffer zone because this is not a disease that we want to take chances with. Good question. All right, so that dog that developed rabies was picked up as a stray with another dog, and that other dog was euthanized for aggression in its evaluation. I'm just going to let that sink in for a second. Rabies didn't enter anybody's mind. We don't know if it was rabies or not. The dog was never tested, but it could have been. So hopefully you guys are going, oh, how many times have I potentially been exposed to rabies and I didn't know it? And I've talked with friends in South Carolina who have seen quite a few cats coming into their shelter, and they've described situations where I know 9 out of 10 shelters would have just disposed of that cat, was perfectly fine, and then was dead the next morning. Sometimes this clinical phase is really, really short. They didn't see anything that suggested rabies, but because they've seen so much rabies in the area, they tested it anyway, and that sudden death was a rabies case. So it's going to be out there. You may become exposed when you don't even know it, and that's why we recommend pre-exposure prophylaxis, right? And all the veterinarians and the staff working with animals, animal control, ideally are going to have pre-exposure prophylaxis. How many of you have pre-exposure prophylaxis? Yes. All right. Good job. That doesn't mean that we don't need post-exposure if we're exposed. We still do, but it's going to give us a faster response to those boosters, and it's going to help protect us if we are exposed and we don't know about it.
I have a quick question.
Mm-hmm.
If you have gone through your series and your titer is still good, but it's been 20 years, would you get a boost anyway?
No, not so. The question is, if you've gone through your pre-exposure series, 20 years later, you've been titer testing all along, and you still have what's considered a positive titer, or should you booster anyway? And the answer is no. I'm the same way. Those of us that got vaccinated back then, we have very, very long-lasting titers that are measurable. People who've been vaccinated more recently have a much more purified vaccine, and their titers tend to wane in a couple years. Now, if your titers wane, are you still protected? Maybe. Probably. You may. I'll tell you, at the Ohio Department of Health, there are 2 people in the state who are trained to do rabies testing, and they get their titers checked every 6 months. They are the highest titers I have ever seen in my life. Yeah.
Another caveat for New York, because I've just done this so much. New York's really weird. Every county public health department, if their laws trump the state laws, you have to go with them.
Yes.
So I am very highly titered. I'm actually allergic to the rabies vaccine, so I have to get put in the hospital every time I get boosted. And I was exposed to a rabid raccoon, and the county health department, even though I had a high titer, still required that I get boosted for rabies.
Absolutely. So she's sharing that she had high titers from pre-exposure, was exposed, and was required to get post-exposure prophylaxis. And that is absolutely correct. That is what's recommended. Titers are a funny thing. This is not a guarantee. We know people who, it's only measuring a tiny part of this complex immune response. And though it's not common, you can have titers and still get rabies. And we've seen that a handful of times. So again, fatal disease, we're not taking risks. If you're exposed, you should receive post-exposure prophylaxis unless you've been vaccinated within the prior 3 months. So with allergies, absolutely you want to have additional care taken to prevent that. And they may alter the recommended course. But the titers are not a guarantee. It's not a check my titers and I don't need post-exposure prophylaxis. We still recommend post-exposure prophylaxis. The titers we really check to see, do we need boosted or not, right? Yeah.
In terms of getting your staff vaccinated, in Canada, rabies vaccines for humans are very expensive. Is that the concern?
It is incredibly expensive.
Now, what about that? So we're spending about $3 on a vaccine for a dog or a cat. So why are human vaccines so expensive?
That is how much time do we have? And they're not even produced in the United States. So we're at the whim of the supply produced in other countries. Rabies immunoglobulin is the most expensive. The vaccines are still a couple $100 each, typically. And it just has to do with the requirements that there are in place for development of human vaccine, right? And they make about what they need. They're not going to make this huge surplus. So a little bit of it is supply and demand and the human health side. There's been research in the works to try and create like a one-size-fits-all species vaccine, and they're pretty similar right now. But the requirements for purification and testing and validation are different on the human side than they are on the pet side. And so I think that really is where most of those costs come from. It's really tragic. Most of the vaccine companies do have an indigent care clause, and they'll provide vaccine for those who need it. And in New York, I believe the health departments actually cover that cost, which is pretty nice because I've seen bills over $30,000 for post-exposure prophylaxis in the US. So very expensive. As practitioners, if you're in practice or you're in a shelter, the pre-exposure obviously is cheaper, another reason that you might want to do that, and it shortens your post-exposure series if you have pre-exposure. But a lot of times you can go to a travel clinic or a health department or another hospital and say, hey, I've got 20 people that need vaccinated, and they may be able to do sort of a bulk vaccine clinic for you and reduce the costs over going through normal healthcare channels. Okay? So, all right, I do want to show these videos because I think that this is really interesting. So this is going to get out in the news, right? Whether public health is using the media to identify potential exposures or whether it's just because it happened and that's what they want to talk about. So it's really important for shelters to have a media plan in place and to manage those contacts. So this was a rabies case associated with a shelter. Pay attention to the tone of this.
Case of rabies at the Valencia County Animal Shelter means more than a dozen dogs in Valencia County will end up being put down. Now the race is on to see how far the disease may have spread. A warning, though, some of the video in this story may be tough to watch. KOAT Action 7 News reporter Todd Kurtz has the details.
Here's that rabid dog first showing symptoms. Workers say they noticed it wore a confused or blank stare. It was whining, and then the biting started. This video was shot Friday night. By Saturday morning, workers say the dog was biting itself and the other dog in the kennel. Both were put down right away.
Shut down the shelter immediately and went on damage control.
The Department of Health is at Valencia County Animal Shelter investigating how far the disease could spread. Dogs don't get rabies shots when arriving because you need a veterinarian for that. In all, 12 more dogs will be put down, and a human worker needs more testing.
He wasn't bitten or anything like that, but he was playing with the dog. There was a lot of licking going on.
Now, the dog was moved to the adoption floor after being here for about a week, and that's what has officials concerned. It was on the adoption floor for 2 days, so it did come in contact with people. It didn't start showing those signs of rabies until later on Friday night.
It's tough. It's been very hard on the crew.
The health department is sending letters to anyone who was recently at the shelter and may have come in contact with the dog, but officials say it's unlikely any humans will contract rabies.
They could, but they'd have to try.
It's highly unlikely without being bitten, isn't it?
Without being bitten or having an open wound licked.
Rabies takes about 10 days to kick in. This dog started showing signs right inside that time frame. Now it's a waiting game to see if any more dogs develop symptoms. Todd Kurtz, KOAT, Action 7 News.
The shelter is still on lockdown, and the other dog suspected of being exposed to the disease will be put down tomorrow morning. The rabid dog was brought in as a stray from the Isleta Pueblo. If you recognize it and think you may have come in contact with it, call the Department of Health immediately.
The take-home points from that were that, it's like rabies scare, this is bad, rabies in your dog shelter, oh my gosh, what's going to happen next, and how are you going to protect your family? And it's really like scary and sensationalized, and like the shelter messed up. When actually the shelter did exactly what their function in the community is, right? So they're bringing in stray animals to keep them off the streets. They identified a rabies case, they're notifying the community, there's an elevated risk of rabies in the area, here's what you want to do. So the shelter really needs to get in front of that. And then I have the next clip that aired just a couple hours later, and it was an incredibly different tone, where, let me see if you can at least hear it.
The Department of Health says a dog in Valencia County has been euthanized because it had rabies. And now they're worried that dog may have infected other dogs or people. Officials say the 6-month-old lab German Shepherd Cross was captured last week. It was taken to the animal shelter because it had been harassing livestock and killing chickens. The dog had not been vaccinated for rabies. It was placed with other shelter dogs who were waiting to be adopted. The Department of Health wants to speak with anyone who may have come into contact with that dog at the shelter last week to talk to them about exposure.
Right, so much calmer presentation, much more informative, and they had gone on to talk about the importance of vaccinating your pets and to getting those messages out into the community. So it's really important how you manage the media. You want to have that in place. And dedicate a spokesperson to talk to the media, because they're going to show up whether you invite them or not, and you don't want them talking to your least favorite volunteer, right? All right, I have a section on Salmonella, and I think what I'll do is I'll roll that into the next hour, and I'll kind of shorten Salmonella and Campylobacter, and then we'll also talk about Brucella canis